Pain does have a lot of consequences, both at the acute level and at the chronic level. So in the immediate effects, usually it generates a lot of fear, and a child with pain is likely to be more irritable when they wake up. In the immediate postoperative period, severe pain can cause sleep disturbances, and because of activation of the endocrine system and the sympathetic system, there is an increase in oxygen consumption. And it can also increase your gastric acid production and decrease your appetite. So a lot of effects of uncontrolled pain. And apart from that, it creates distress to the parents, to the nursing staff, to the doctor who's taking care of the patient. Pain is also shown to decrease the immune function of the body, which makes us more susceptible to infections, because of which there could be delayed healing as well, and it can produce a negative catabolic response, okay, or a negative nitrogen balance. So a lot of hidden side effects which we as healthcare professionals may not be aware, but this is something which we need to be aware and educate the staff we work with, including the surgeons. Now, what are the long-term effects of pain? So any child who's had an unpleasant experience in the past can retain the memories of the past and carry it on to the future. That's number one. And second, this uncontrolled pain can also lead to changes in the nervous system, which can cause a permanent decrease in the pain threshold. Okay, to give you an example, a child who's had a circumcision as a neonate without pain relief has increased or has a lower threshold for pain for any further surgical intervention or any painful stimuli. So these children can also have abnormal behavioral responses to vaccination. Would you imagine that? A child who's had a circumcision as a neonate without pain relief will react quite differently to a vaccine injection compared to a child who's had a good pain relief. So that's the amount of damage a pain can do to a small child. So some basics about physiology of pain. So it's clearly proven without doubt that all children do feel pain, and younger children, particularly less than 6 months, feel more pain than an older child, and the pain is best prevented than treated, as with anything. And small age group, particularly the premature neonates and the term neonates, are more sensitive to opioids.